Question 1. Quality control measures reveal that a social worker is working with a client who has a history of childhood abuse and has expressed significant difficulty trusting others. During initial sessions, the client is withdrawn, speaks in short sentences, and avoids eye contact. The social worker is concerned about the client's reluctance to engage and is considering how best to proceed to build a therapeutic relationship. Option A. Social worker should patiently continue to offer a safe and non-judgmental space, actively listen to what the client is willing to share, and allow the client to set the pace of disclosure, reinforcing consistency and reliability in their interactions. Option B. The social worker should adopt a more directive approach, outlining specific goals and expectations for the client to meet in each session to demonstrate the structure and control that can be beneficial. Option C. The social worker should gently but firmly encourage the client to discuss their past experiences of abuse, explaining that this is necessary for progress in therapy. Option D. The social worker should share personal anecdotes about their own past struggles with trust to help the client feel more comfortable and connected. Correct answer is A. The social worker should patiently continue to offer a safe and non-judgmental space, actively listen to what the client is willing to share, and allow the client to set the pace of disclosure, reinforcing consistency and reliability in their interactions. Explanation. This scenario presents a professional challenge because the social worker is attempting to establish a therapeutic alliance with a client who has a history of trauma and mistrust of authority figures. The client's guardedness and reluctance to share personal information are direct manifestations of their past experiences. The social worker's primary ethical obligation, as guided by the ASWB Advanced Generalist Exams Regulatory Framework, which aligns with the National Association of Social Workers Code of Ethics and relevant state licensing board regulations, is to promote the well-being of clients and to maintain professional boundaries while fostering a safe and trusting environment. The correct approach involves the social worker demonstrating patience, empathy, and consistency in their interactions. This means actively listening, validating the client's feelings without judgment, and allowing the client to set the pace of the relationship. The social worker should focus on building trust through predictable and reliable engagement, offering choices where appropriate, and respecting the client's autonomy. This aligns with ethical principles of client self-determination and the importance of a strong therapeutic relationship as a foundation for effective intervention. The NASWA Code of Ethics emphasizes the importance of respecting the dignity and worth of the person, and building rapport is fundamental to this. An incorrect approach would be to pressure the client to disclose information before they are ready. This could be perceived as intrusive and re-traumatizing, further eroding trust and potentially leading to premature termination of services. Such an approach violates the ethical principle of avoiding harm and could be seen as a failure to respect the client's boundaries and pace. Another incorrect approach would be to overshare personal information about the social worker's own life. While some limited self-disclosure can sometimes be appropriate to build rapport, excessive sharing blurs professional boundaries, shifts the focus away from the client's needs, and can create an unhealthy dynamic where the client feels responsible for the social worker's well-being. This violates the ethical standard of maintaining professional boundaries and prioritizing the client's needs. A further incorrect approach would be to adopt a purely directive or authoritative stance, assuming the client will automatically comply with the social worker's agenda. This fails to acknowledge the client's lived experience and the potential for their past experiences to influence their current interactions. It disregards the principle of client-centered practice and the importance of a collaborative relationship. The professional decision-making process in such situations requires the social worker to continuously assess the client's readiness and comfort level, adapt their interventions accordingly, and prioritize the establishment of a safe and trusting relationship. This involves active listening, empathy, patience, and a commitment to ethical practice, ensuring that all actions are in the best interest of the client and align with professional standards. Question 2. Investigation of a client presenting with persistent anxiety and relationship difficulties. A social worker trained in psychodynamic theory considers how to best address the client's presenting concerns. The client expresses frustration with their current situation, but also exhibits resistance to exploring deeper emotional issues, often redirecting the conversation to superficial complaints. Social worker recognizes the potential for transference and the importance of understanding the client's developmental history in shaping their current patterns. Which of the following approaches best aligns with psychodynamic principles and advanced generalist practice in this situation? Option A. Directly interpret the client's resistance as a manifestation of a specific defense mechanism, pushing for immediate insight into its origins. Option B. Suggest that the client's difficulties are likely due to external circumstances and encourage them to focus on changing their environment. Option C. Focus primarily on teaching the client coping mechanisms and stress reduction techniques to manage their immediate anxiety symptoms. Option D. Gently encourage the client to explore the underlying, unconscious conflicts and past experiences that may be contributing to their anxiety and relationship patterns, while being mindful of the therapeutic alliance and the client's pace. The correct answer is D. Gently encourage the client to explore the underlying, unconscious conflicts and past experiences that may be contributing to their anxiety and relationship patterns, while being mindful of the therapeutic alliance and the client's pace. Explanation. This scenario presents a professional challenge because the social worker must balance the client's immediate distress with the long-term implications of therapeutic interventions, particularly when considering the foundational principles of psychodynamic theory. The client's resistance and the potential for transference require careful navigation to ensure the therapeutic alliance remains intact and productive, adhering to ethical standards of client welfare and informed consent. The correct approach involves the social worker facilitating the client's exploration of the underlying, unconscious conflicts contributing to their current anxiety, drawing on psychodynamic principles. This aligns with the ASWB Advanced Generalist exam's emphasis on understanding and applying theoretical frameworks to complex client issues. Specifically, it reflects the ethical imperative to provide services that are theoretically sound and client-centered, respecting the client's pace and internal world. This approach prioritizes depth of understanding and resolution over superficial symptom management, which is a hallmark of advanced generalist practice. An incorrect approach that focuses solely on immediate symptom reduction without exploring the root causes would fail to address the core issues identified by psychodynamic theory. This could lead to a superficial resolution that is not sustainable and may not fully empower the client. Ethically, this approach might be considered a failure to provide comprehensive and effective services, potentially violating the principle of promoting client self-determination and well-being by not fully exploring all avenues for growth. Another incorrect approach that involves imposing interpretations or pushing the client towards specific insights prematurely would disregard the client's readiness and the delicate nature of transference and countertransference. This could damage the therapeutic relationship, create resistance, and potentially re-traumatize the client. This violates ethical guidelines regarding the maintenance of professional boundaries and the importance of a strong therapeutic alliance built on trust and respect for the client's autonomy. The professional decision-making process for similar situations should involve a thorough assessment of the client's presenting problem through a psychodynamic lens, considering potential unconscious influences and developmental stages. The social worker must then select interventions that are consistent with the chosen theoretical framework, prioritizing the client's safety, dignity, and self-determination. Continuous evaluation of the therapeutic process, including the client's responses and the dynamics of the therapeutic relationship, is crucial for adapting interventions and ensuring ethical practice. Question 3. The performance metrics show a consistent decline in a client's engagement with community resources following a recent life transition. The social worker has observed that the client often expresses feelings of hopelessness and withdrawal when discussing these resources. Based on behavioral theory, which of the following interventions would be most appropriate to increase the client's engagement? Option A. Encouraging the client to observe peers who are successfully utilizing community resources and modeling their behavior. Option B. Reducing the number of community resources presented to the client to avoid overwhelming them. Option C. Implementing a system of small, tangible rewards for each instance of the client successfully accessing a community resource. Option D. Discussing the negative consequences of not engaging with resources and the potential for further isolation. The correct answer is C. Implementing a system of small, tangible rewards for each instance of the client successfully accessing a community resource. Explanation. This scenario presents a professional challenge because it requires the social worker to interpret behavioral data and select an intervention strategy that is both ethically sound and aligned with best practices in behavioral theory, while also considering the client's autonomy and the potential for unintended consequences. The social worker must move beyond simply observing behavior to actively applying theoretical frameworks to promote positive change. The correct approach involves utilizing principles of operant conditioning, specifically positive reinforcement, to encourage desired behaviors. This aligns with Skinner's work, which emphasizes how consequences shape behavior. By identifying a reinforcer that is meaningful to the client and consistently applying it when the target behavior occurs, the social worker can increase the likelihood of that behavior recurring. This approach respects the client's agency by focusing on building new, adaptive behaviors rather than solely on eliminating problematic ones. Ethically, this is supported by principles of beneficence and non-maleficence, as it aims to improve the client's functioning in a constructive manner. An incorrect approach would be to solely focus on punishment or extinction, without a clear understanding of the client's motivations or the potential for negative side effects. For instance, implementing a punitive measure without exploring the underlying reasons for the behavior could lead to increased distress, resentment, and a breakdown in the therapeutic relationship, violating the principle of non-maleficence. Another incorrect approach would be to apply a generalized intervention without tailoring it to the individual client's specific needs and reinforcers, which would be ineffective and potentially disrespectful of the client's unique circumstances, failing to uphold the principle of client-centered care. Relying solely on observational learning, Bandura, without actively shaping the behavior through reinforcement, would also be insufficient if the goal is to increase the frequency of a specific, desired action. Professionals should approach such situations by first conducting a thorough functional behavioral assessment to understand the antecedents and consequences of the target behavior. This assessment should inform the selection of an intervention that is theoretically grounded, client-centered, and ethically justifiable. Ongoing evaluation of the intervention's effectiveness is crucial, with adjustments made as needed based on observed outcomes and client feedback. Question 4. The evaluation methodology shows that a client who has been referred for mental health services due to symptoms of depression and anxiety is hesitant to attend individual therapy sessions. During the assessment, the client expresses significant worry about their family's perception of mental health treatment and a fear of community gossip, which they believe will negatively impact their family's social standing. The social worker needs to determine the most appropriate next step to facilitate the client's engagement with services. Option A. Explore the client's concerns about family perception and community stigma, and collaboratively develop strategies to address these external influences, potentially involving family or community resources with the client's consent. Option B. Advise the client that their personal beliefs about family and community are not relevant to their mental health treatment and proceed with scheduling therapy sessions. Option C. Directly contact the client's family to explain the importance of mental health treatment and address their potential concerns about social stigma. Option D. Focus solely on educating the client about the benefits of therapy and encouraging them to overcome their personal fears and reservations about attending sessions. Correct answer is A. Explore the client's concerns about family perception and community stigma, and collaboratively develop strategies to address these external influences, potentially involving family or community resources with the client's consent. Explanation. This scenario presents a professional challenge because the social worker must navigate multiple layers of influence on the client's well-being, moving beyond the immediate individual microsystem to consider broader environmental factors. The client's reluctance to engage with services, stemming from family pressures and community stigma, highlights the interconnectedness of various systems. Ethical practice demands a comprehensive assessment that acknowledges these influences to develop an effective intervention plan. The correct approach involves recognizing the client's situation within their exosystem, e.g., the impact of the community's perception of mental health services on their family's willingness to support treatment, and macrosystem, e.g., societal attitudes towards mental illness. By collaborating with the client to identify and address these external barriers, the social worker upholds the ethical principle of self-determination while also promoting client empowerment and facilitating access to necessary support. This aligns with the ASWB Code of Ethics, which emphasizes understanding clients within their environmental context and advocating for systemic change when necessary. An approach that focuses solely on the client's individual willingness to attend therapy without exploring the family's concerns or community stigma fails to address the root causes of the resistance. This overlooks the exosystemic and macrosystemic influences that are significantly impacting the client's access to care, potentially leading to a less effective and potentially harmful intervention. It also risks violating the ethical principle of competence by not conducting a thorough assessment. Another incorrect approach would be to directly confront the family or community leaders without first understanding the client's perspective and gaining their consent. This could alienate the client and their support network, further entrenching resistance and violating the principle of informed consent and client confidentiality. It also fails to recognize the client's agency in navigating these systemic challenges. Finally, an approach that dismisses the client's concerns about family and community as mere excuses and proceeds with a standardized treatment plan demonstrates a lack of cultural humility and an insufficient understanding of the client's lived experience. This can lead to a breakdown in the therapeutic relationship and a failure to meet the client's needs, potentially causing harm. The professional decision-making process for similar situations should involve a systematic assessment of the client's microsystem, mesosystem, exosystem, macrosystem, and chronosystem. This includes actively listening to the client's narrative, exploring their perceptions of these systems, and collaboratively identifying potential interventions that address barriers at each level. Ethical considerations, such as self-determination, confidentiality, and competence, must guide every step of the process. Question 5. When evaluating a situation where an elderly client with a history of cognitive decline expresses a strong desire to move into a new, independent living arrangement that presents potential safety concerns, what is the most ethically and professionally sound course of action for the social worker? Option A. Override the client's decision and arrange for them to remain in their current, familiar environment, believing it to be the safest option based on the social worker's professional judgment. Option B. Immediately facilitate the client's move to the new living arrangement as requested, respecting their expressed autonomy above all other considerations. Option C. Inform the client that their cognitive decline makes them incapable of making such decisions and proceed with placing them in a more restrictive care facility without further assessment or discussion. Option D. Conduct a comprehensive assessment of the client's decision-making capacity regarding this specific living arrangement, exploring their understanding of the risks and benefits, and if capacity is lacking, proceed with a plan that prioritizes safety while seeking least restrictive alternatives and involving appropriate support systems. The correct answer is D. Conduct a comprehensive assessment of the client's decision-making capacity regarding this specific living arrangement, exploring their understanding of the risks and benefits, and if capacity is lacking, proceed with a plan that prioritizes safety while seeking least restrictive alternatives and involving appropriate support systems. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's expressed desire and the social worker's ethical obligation to ensure the client's safety and well-being, particularly when the client may lack full capacity to understand the consequences of their choices. The social worker must navigate the principles of self-determination and beneficence, balancing the client's autonomy with the duty to protect. The correct approach involves a thorough assessment of the client's capacity to make the specific decision regarding their living situation. This requires evaluating their understanding of the risks and benefits, their ability to weigh options, and their freedom from undue influence. If capacity is determined to be lacking, the social worker must then engage in a process that prioritizes the client's safety while exploring least restrictive alternatives and involving appropriate support systems, such as family or legal guardians, in accordance with ethical codes and relevant state laws governing guardianship and protective services. This aligns with the NASWA Code of Ethics, specifically the sections on self-determination and client well-being, and state-specific statutes that mandate protection for vulnerable adults. An incorrect approach would be to immediately accede to the client's request without a capacity assessment. This fails to uphold the ethical principle of beneficence and could lead to harm if the client is unable to manage the risks associated with the proposed living arrangement. Another incorrect approach would be to unilaterally override the client's wishes based on the social worker's personal judgment of what is best, without a formal capacity assessment or exploration of less restrictive interventions. This violates the principle of self-determination. Finally, isolating the client and making decisions without attempting to involve them or their support network, even if capacity is questionable, would be ethically unsound and potentially violate legal requirements for due process and involvement of appropriate parties. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the client's situation, including their stated desires, potential risks, and their capacity to understand and make informed decisions. This framework should then guide the social worker to explore all available options, prioritizing interventions that are least restrictive while ensuring safety and promoting client well-being. Collaboration with the client, their support system, and relevant professionals, along with adherence to ethical codes and legal mandates, are crucial throughout this process. Question 6. Strategic planning requires a social worker to consider a young adult client's expressed desire to move out of their parents' home and live independently. The client, who is in their early 20s, states they feel ready for this step and want to pursue romantic relationships and establish their own identity. The social worker, however, has noted some financial instability and occasional difficulties with executive functioning in the client's past interactions. The social worker is familiar with Erikson's stages of psychosocial development, particularly the stage of intimacy vs. isolation, which is typically associated with this age group. Which of the following approaches best reflects an ethical and developmentally informed intervention? Option A. Support the client's desire to move out by helping them develop a comprehensive budget, identify potential support systems in the community, and explore strategies for managing executive functioning challenges, while acknowledging the developmental importance of pursuing independence and intimacy. Option B. Advise the client that their desire to move out is a sign of immaturity and that they should focus on resolving their current challenges before considering such a significant life change. Option C. Respect the client's stated desire to move out and agree to the plan without further assessment or intervention, as the client's self-determination is paramount. Option D. Encourage the client to delay moving out until their financial situation is more stable and they demonstrate improved executive functioning, as these are critical for successful independent living. The correct answer is D. Encourage the client to delay moving out until their financial situation is more stable and they demonstrate improved executive functioning, as these are critical for successful independent living. Explanation. This scenario presents a professional challenge because the social worker must balance the client's expressed desire for independence with the potential risks identified by a developmental theory, requiring careful ethical judgment. The social worker's duty of care and the principle of client self-determination are in tension. The correct approach involves a comprehensive assessment that integrates the client's subjective experience with objective observations and theoretical understanding. This approach prioritizes client autonomy while ensuring safety and well-being, aligning with the ASWB Code of Ethics' emphasis on respecting the dignity and worth of the person and promoting self-determination. Specifically, the social worker should use Erikson's stage of intimacy vs. isolation, young adulthood, to understand the client's current developmental task. The client's desire to move out, despite potential financial instability, can be viewed as an attempt to achieve independence and form intimate relationships, a key developmental milestone. The social worker's role is to support this developmental progression by exploring the client's readiness, identifying potential barriers, and collaboratively developing strategies to mitigate risks, rather than imposing a solution based solely on one aspect of a theory or a single observation. This respects the client's agency while fulfilling the social worker's ethical obligation to promote client well-being. An incorrect approach would be to solely focus on the client's financial instability and recommend delaying the move. This approach fails to acknowledge the client's developmental stage and the importance of pursuing independence and forming relationships, potentially hindering their psychosocial development as described by Erikson. Prioritizes a single risk factor over the client's overall developmental needs and self-determination, which is ethically problematic. Another incorrect approach would be to dismiss the client's desire to move out as a sign of immaturity or poor judgment without further exploration. This approach is dismissive and paternalistic, failing to recognize the client's developmental stage and their right to make choices about their life. It also ignores the potential for the client to develop coping mechanisms and support systems to manage the challenges of independent living. A third incorrect approach would be to solely rely on the client's stated desire without considering the broader developmental context or potential risks. While client self-determination is crucial, social workers also have an ethical responsibility to ensure client safety and well-being. Ignoring potential risks, even when the client expresses a strong desire, can lead to negative outcomes and compromise the client's progress. The professional decision-making process for similar situations should involve a multifaceted assessment that considers the client's developmental stage, their stated goals and desires, potential risks and protective factors, and available resources. This process should be collaborative, empowering the client to participate actively in decision-making, while ensuring that the social worker fulfills their ethical obligations. Applying relevant developmental theories, such as Erikson's psychosocial stages, can provide a framework for understanding the client's motivations and challenges, but these theories should inform, not dictate, the intervention plan. Question 7. Analysis of a client's presentation reveals a strong desire for immediate gratification of a specific impulse, a tendency to rationalize decisions to avoid responsibility, and a deep-seated guilt about past actions. Which approach best reflects a social worker's ethical and professional responsibility in understanding and addressing this client's internal dynamics? Option A. Counsel the client to suppress all impulses and strictly adhere to societal expectations and moral standards, regardless of their personal feelings. Option B. Facilitate the client's exploration of the underlying needs driving the impulse, help them assess potential consequences of acting on it, and encourage reflection on their values and moral beliefs to guide their decision-making. Option C. Dismiss the client's expressed impulse as irrational and focus solely on the client's perceived rationalizations, ignoring their emotional experience. Option D. Directly fulfill the client's immediate desire to satisfy the impulse, as this is the most direct way to alleviate their current distress. The correct answer is B. Facilitate the client's exploration of the underlying needs driving the impulse, help them assess potential consequences of acting on it, and encourage reflection on their values and moral beliefs to guide their decision-making. Explanation. This scenario presents a professional challenge because the social worker must navigate the complex interplay of a client's internal psychological drives, i.e., ego, superego, while adhering to ethical mandates and legal requirements for client welfare and autonomy. The challenge lies in distinguishing between a client's immediate desires, their rational decision-making capacity, and their internalized moral compass, all within the context of providing appropriate services. Careful judgment is required to ensure interventions are client-centered, culturally sensitive, and do not impose the social worker's own values or interpretations. The correct approach involves a comprehensive assessment that considers the client's stated desires, ID impulses, their ability to weigh consequences and make informed choices, ego functioning, and their moral and ethical considerations, superego influences. This approach prioritizes empowering the client to understand and integrate these different aspects of their personality to make decisions that align with their overall well-being and values. This aligns with the ASWB Code of Ethics, which emphasizes client self-determination, informed consent, and the social worker's responsibility to promote client welfare. Specifically, Standard 1.0.5, Integrity in Professional Relationships, and Standard 1.0.2, Self-Determination, guide the social worker to respect and promote the right of clients to self-determination, provided that their actions do not harm themselves or others. The social worker's role is to facilitate the client's understanding of their internal dynamics, not to dictate outcomes. An incorrect approach that focuses solely on fulfilling the client's immediate wishes without considering potential negative consequences or ethical implications fails to acknowledge the ego's reality testing function and the superego's role in moral reasoning. This could lead to interventions that are detrimental to the client's long-term well-being, violating the ethical principle of avoiding harm, Standard 1.0.1. Another incorrect approach that prioritizes imposing societal norms or the social worker's personal moral code over the client's autonomy disregards the principle of self-determination and can lead to paternalistic interventions. This also violates the ethical mandate to respect clients' diverse backgrounds and values. A third incorrect approach that dismisses the client's expressed desires as purely impulsive without exploring the underlying needs or motivations fails to engage with the client's ID in a constructive way, potentially alienating the client and hindering the therapeutic process. The professional decision-making process for similar situations should involve a systematic assessment of the client's presenting problem, considering their internal psychological landscape through the lens of ID, ego, and superego. This assessment should be integrated with an understanding of the client's social, cultural, and environmental context. The social worker must then identify potential interventions that respect client self-determination, promote informed consent, and aim to enhance the client's capacity for reality-based decision-making and ethical consideration. Collaboration with the client, exploring their feelings, thoughts, and values, is paramount throughout this process. Question 8. The audit findings indicate a need to enhance the social worker's integration of developmental theories into client assessments. A client presents with significant interpersonal relationship difficulties and a pervasive fear of abandonment. The social worker has documented these presenting problems but has not explored potential underlying developmental factors. Which of the following approaches best reflects a comprehensive assessment informed by psychosexual developmental theory? Option A. Focus exclusively on the client's current coping mechanisms and immediate social support systems to address the fear of abandonment. Option B. Recommend immediate medication management for anxiety symptoms associated with the fear of abandonment, deferring any exploration of developmental history. Option C. Explore the client's experiences and potential unresolved conflicts during the oral stage, considering how early dependency needs and gratification might influence current relationship patterns and fears. Option D. Interpret the client's relationship difficulties as a normal part of adult life and encourage them to develop more resilient social skills without further developmental inquiry. The correct answer is C. Explore the client's experiences and potential unresolved conflicts during the oral stage, considering how early dependency needs and gratification might influence current relationship patterns and fears. Explanation. This scenario is professionally challenging because it requires the social worker to balance the client's immediate distress with the need to understand the underlying developmental issues contributing to their current presentation. The audit findings suggest a potential gap in the social worker's assessment process, specifically regarding the integration of developmental theory into practice. The ASWB Advanced Generalist exam emphasizes the application of theoretical frameworks to complex client situations, and understanding the stages of psychosexual development is a core component of this. The correct approach involves recognizing that the client's current difficulties may be rooted in unresolved issues from earlier developmental stages, as described by Freud. This perspective allows for a more comprehensive assessment and intervention plan that addresses not only the presenting problem, but also its potential origins. This aligns with ethical practice standards that mandate a thorough and holistic assessment of clients, considering their developmental history. Specifically, ethical codes often require social workers to understand and apply relevant theoretical frameworks to inform their practice, which includes developmental theories. An incorrect approach would be to solely focus on the immediate behavioral manifestations without exploring potential underlying developmental conflicts. This superficial approach fails to address the root causes of the client's distress and may lead to ineffective or even detrimental interventions. It neglects the ethical imperative to conduct a comprehensive assessment that considers the client's entire developmental trajectory. Another incorrect approach would be to dismiss the client's current issues as simply a consequence of their age or a phase they are going through, without a systematic exploration of developmental stages. This dismissive attitude can invalidate the client's experience and prevent the identification of critical developmental arrests or fixations that require targeted intervention. It violates the ethical principle of respecting the inherent dignity and worth of the client by failing to engage with their struggles on a deeper, developmental level. A further incorrect approach would be to pathologize the client's behaviors without considering the potential for normal developmental processes to manifest in ways that might appear problematic from an adult perspective. This can lead to misdiagnosis and inappropriate treatment, failing to recognize that certain behaviors are characteristic of specific developmental stages. It is ethically unsound to label behaviors without a thorough understanding of their developmental context. The professional decision-making process in such situations should involve a systematic review of the client's history, including their developmental milestones and any reported difficulties at different life stages. The social worker should then consider how theoretical frameworks, such as Freud's stages of psychosexual development, can illuminate the client's current presentation. This involves identifying potential fixations or unresolved conflicts at specific stages: oral, anal, phallic, latency, genital, and how these might manifest in adult behavior. The intervention plan should then be tailored to address these identified developmental issues in conjunction with the presenting problems, ensuring a comprehensive and ethically grounded approach. Question 9. Process analysis reveals that a 14-year-old client is experiencing increased conflict at home, is spending more time with a new group of friends whose behaviors are concerning to their parents, and is showing a decline in academic performance. The social worker is tasked with developing an intervention plan. Which of the following approaches best reflects a comprehensive understanding of agents of socialization in this situation? Option A. Focus on the client's academic struggles, assuming that improved grades will naturally resolve behavioral issues and improve family dynamics. Option B. Conduct a thorough assessment of the influence of family, peers, school, and community on the client's development, exploring the client's perceptions and experiences within each context, and identifying potential strengths and challenges across all domains. Option C. Immediately recommend family counseling to address the home conflicts, believing that resolving parental issues will be the primary driver of positive change for the client. Option D. Prioritize addressing the negative peer influences by implementing strategies to limit the client's contact with this group and reinforcing parental authority. Correct answer is D. Prioritize addressing the negative peer influences by implementing strategies to limit the client's contact with this group and reinforcing parental authority. Explanation: this scenario is professionally challenging because the social worker must navigate the complex interplay of established family dynamics and the emerging influence of peer groups on a minor client. The social worker's role is to support the client's well-being and development, which requires understanding and addressing the various agents of socialization impacting them. Careful judgment is required to avoid imposing personal values or prematurely labeling influences as solely positive or negative, instead focusing on the client's experience and developmental needs. The correct approach involves a comprehensive assessment of all significant agents of socialization, including family, peers, school, and community, and how they interact to shape the client's identity and behavior. This approach aligns with the ASWB Advanced Generalist exam's emphasis on a holistic understanding of clients within their social environment, as mandated by ethical codes that require social workers to understand the client's strengths and challenges within their context. Specifically, ethical standards emphasize the importance of cultural competence and understanding diverse influences on client development, which necessitates a broad assessment of socialization agents, an approach that solely focuses on the negative aspects of peer influence, while disregarding the potential positive contributions of family or other supportive relationships, is ethically flawed. This narrow focus can lead to biased interventions and a failure to recognize the client's existing strengths and support systems. It violates the principle of self-determination by potentially undermining the client's existing familial bonds without sufficient evidence of harm. An approach that prioritizes the social worker's perception of ideal socialization over the client's lived experience is also ethically unacceptable. This can manifest as imposing external standards without considering the client's developmental stage, cultural background, or individual circumstances. Such an approach risks alienating the client and failing to build a trusting therapeutic relationship, which is fundamental to effective social work practice. Furthermore, an approach that solely relies on the client's self-report without seeking corroborating information from other relevant sources, such as parents or school personnel, with appropriate consent, can lead to an incomplete or inaccurate understanding of the client's socialization experiences. This can result in misdiagnosis or the development of ineffective intervention strategies. The professional decision-making process for similar situations should involve a systematic assessment that includes: 1. Identifying all potential agents of socialization impacting the client. 2. Evaluating the nature and strength of each influence, considering both positive and negative aspects. 3. Assessing how these influences interact and contribute to the client's current functioning and developmental trajectory. 4. Collaborating with the client, and where appropriate and consented to, other significant individuals or systems to gather a comprehensive picture. 5. Developing interventions that are client-centered, culturally sensitive, and aimed at enhancing the client's strengths and addressing challenges in a balanced and ethical manner. Question 10. Research into a family's challenges reveals a child exhibiting disruptive behaviors at school and home. The social worker observes strained parent-child interactions, notes the mother's recent job loss and increased stress, and is aware of limited after-school programs in their low-income neighborhood. Considering Bronfenbrenner's ecological systems theory, which of the following approaches would best inform the social worker's intervention strategy? Option A. Recommend immediate placement of the child in a specialized behavioral program while the parents address their financial and emotional difficulties. Option B. Focus on individual therapy for the child to address behavioral deficits and provide parenting skills training to the mother. Option C. Conduct a comprehensive assessment of the child's interactions within their family microsystem, the connections between home and school mesosystem, the impact of the mother's employment status and community resources exosystem, and broader societal attitudes towards poverty macrosystem, to identify systemic strengths and stressors. Option D. Primarily focus on advocating for increased funding for school counselors to address the child's behavioral issues. The correct answer is B. Focus on individual therapy for the child to address behavioral deficits and provide parenting skills training to the mother. Explanation. This scenario is professionally challenging because the social worker must balance the immediate needs of the child with the complex, interconnected factors influencing the family's functioning, as conceptualized by ecological systems theory. The social worker needs to move beyond a singular focus on the child's behavior to understand how various environmental systems interact and impact the family unit. This requires a nuanced assessment that considers the microsystem, family interactions, mesosystem, connections between home and school, exosystem, parents' workplace policies, and macrosystem, societal attitudes towards poverty and mental health. The correct approach involves a comprehensive assessment that utilizes ecological systems theory to understand the interplay of these systems. This aligns with the ASWB Advanced Generalist exam's emphasis on a holistic, strengths-based perspective that considers the client within their environment. Specifically, the NASWA Code of Ethics, Standard 1. 01 Commitment to Clients, Standard 1. 05 Cultural Awareness and Social Diversity, Standard 1. 06 Conflicts of Interest, Standard 2. 01 Competence mandates that social workers strive to help clients and enhance their well-being while being sensitive to cultural and environmental factors. By focusing on the interconnectedness of the child's home, school, and community, and identifying potential strengths and stressors within each system, the social worker can develop a more effective and sustainable intervention plan. This approach respects the client's right to self-determination by involving them in identifying solutions that address the root causes of their challenges. An incorrect approach would be to solely focus on the child's behavioral issues without exploring the broader environmental influences. This fails to acknowledge the systemic nature of problems and can lead to superficial interventions that do not address underlying issues. For instance, recommending only individual therapy for the child without considering parental stress, lack of community resources, or negative school interactions neglects crucial elements of the child's ecological context. This violates the ethical principle of competence by not conducting a thorough assessment and potentially leading to ineffective service delivery. Another incorrect approach would be to blame the parents for the child's behavior without considering the exosystemic or macrosystemic pressures they face. This is ethically problematic as it can lead to stigmatization and a failure to identify systemic barriers that contribute to the family's difficulties. It also overlooks the potential for interventions at higher system levels, such as advocating for improved parental leave policies or community support services. A third incorrect approach would be to impose solutions without engaging the family in the assessment and planning process. This undermines clients' self-determination and can lead to interventions that are not culturally relevant or sustainable. Ethical standards emphasize client participation and empowerment, which are compromised when external solutions are dictated without understanding the family's lived experience and their capacity to implement change within their specific ecological context. The professional decision-making process for similar situations should involve 1. Conducting a thorough ecological assessment to identify all relevant systems and their interactions. 2. Prioritizing client strengths and resources within each system. 3. Collaboratively developing intervention goals and strategies with the client, considering the influence of multiple environmental levels. 4. Continuously evaluating the effectiveness of interventions and adjusting the plan based on ongoing assessment of the client's ecological context. Question 11. Operational review demonstrates that a social worker is working with a client who presents with significant distress and functional impairment. The client expresses a strong desire for a specific diagnosis, believing it will validate their experiences and help them access certain support services. However, based on the initial assessment, the social worker believes the client's presentation may not fully meet the criteria for the diagnosis the client is seeking, and other diagnoses might be more appropriate, or a diagnosis may not be immediately warranted. The social worker is concerned about misdiagnosis and the potential impact on the client's treatment and self-perception. What is the most ethical and professionally sound approach for the social worker to take in this situation? Option A. Gently but firmly explain to the client that their presentation does not meet the criteria for the diagnosis they desire and attempt to steer them towards a diagnosis the social worker believes is more appropriate, regardless of the client's input. Option B. Conduct a comprehensive diagnostic assessment using DSM-5TR criteria, explore differential diagnoses, and collaboratively discuss the findings and potential diagnostic implications with the client, respecting their self-determination while ensuring diagnostic accuracy. Option C. Avoid making any diagnosis at this time, as the client's insistence on a specific diagnosis and the social worker's uncertainty create too much risk for misdiagnosis. Option D. Immediately provide the client with the diagnosis they are seeking, as their expressed desire and perceived need for validation are paramount. The correct answer is B. Conduct a comprehensive diagnostic assessment using DSM-5TR criteria, explore differential diagnoses, and collaboratively discuss the findings and potential diagnostic implications with the client, respecting their self-determination while ensuring diagnostic accuracy. Explanation. This scenario is professionally challenging because it involves a potential conflict between a client's expressed wishes and the social worker's professional judgment regarding diagnostic criteria and the potential impact of a diagnosis. The social worker must balance respecting client autonomy with their ethical obligation to provide accurate and beneficial services, which includes appropriate diagnostic assessment. The DSM-5TR provides the standard for diagnosis, and misapplication can lead to ineffective treatment, stigma, and potential harm. The correct approach involves a thorough assessment process that adheres to DSM-5TR criteria, while also considering the client's subjective experience and the social context. This includes gathering comprehensive information, exploring differential diagnoses, and engaging in collaborative decision-making with the client about the diagnostic process and its implications. The ethical justification lies in the NASWA Code of Ethics, which emphasizes client well-being, competence, and accurate representation. Specifically, Standard 1.0.5, Integrity of the Profession, and Standard 4.0.1, Competence, are relevant, requiring social workers to practice within their areas of competence and to represent themselves and their qualifications accurately. Furthermore, Standard 1.0.2, Self-Determination, mandates respecting and promoting the right of clients to self-determination to the extent possible and appropriate. An incorrect approach would be to immediately assign a diagnosis based on limited information, or to dismiss the client's concerns without a thorough assessment. This fails to uphold the principle of competence, as it suggests a superficial understanding of diagnostic processes. It also violates the principle of self-determination by potentially overriding the client's narrative without adequate exploration. Another incorrect approach would be to avoid making a diagnosis altogether due to discomfort or uncertainty, even when the client's presentation strongly suggests a diagnosable condition. This could be seen as a failure of competence and a disservice to the client, as a diagnosis can be crucial for accessing appropriate services and understanding their experiences. Finally, pressuring the client to accept a diagnosis that does not align with their understanding or experience, even if it seems clinically indicated, would be a violation of self-determination and could damage the therapeutic alliance. The professional reasoning process should involve a systematic approach. First, gathering all relevant information through interviews, collateral contacts, with consent and observation. Second, consulting the DSM-5TR for diagnostic criteria and considering differential diagnoses. Third, engaging the client in a discussion about their symptoms and experiences, exploring their understanding of their difficulties. Fourth, collaboratively determining if a diagnosis is appropriate and beneficial for the client's treatment goals. And fifth, documenting the assessment and diagnostic process thoroughly and ethically. Question 12. Comparative studies suggest that individuals with progressive neurological disorders often experience fluctuating cognitive abilities. A social worker is meeting with a client diagnosed with early-stage Alzheimer's disease who expresses a strong desire to continue living independently in their home, despite exhibiting some recent memory lapses and occasional disorientation. The social worker is concerned about the client's safety and ability to manage daily tasks. What is the most ethically and legally sound approach for the social worker to take in this situation, adhering to ASWB Advanced Generalist exam standards? Option A. Conduct a comprehensive functional assessment to determine the client's current capacity to live independently, involving the client in identifying specific supports and modifications that would enhance their safety and autonomy. Option B. Advise the client that due to their diagnosis, independent living is no longer a safe or viable option, and begin the process of transitioning them to a residential care facility. Option C. Immediately contact the client's adult children to discuss their concerns and explore options for assisted living, as the diagnosis of Alzheimer's disease generally indicates a decline in independent living capabilities. Option D. Respect the client's wishes to live independently without further assessment, assuming that their desire for autonomy outweighs any potential safety risks, and document their preference. The correct answer is A. Conduct a comprehensive functional assessment to determine the client's current capacity to live independently, involving the client in identifying specific supports and modifications that would enhance their safety and autonomy. Explanation. This scenario presents a professional challenge because the social worker must balance the client's expressed desire for autonomy with the potential risks associated with their cognitive impairment due to a neurological disorder. The social worker needs to assess the client's capacity to make informed decisions, ensuring their safety and well-being while respecting their right to self-determination. This requires a nuanced understanding of ethical principles and legal frameworks governing client capacity and informed consent. The correct approach involves a thorough assessment of the client's capacity to understand the information relevant to their decision, appreciate the consequences of their choices, and communicate their decision. This aligns with the ASWB Code of Ethics, which emphasizes respecting clients' right to self-determination and promoting their well-being. Specifically, Standard 1.02, Self-determination, and Standard 1.05, Integrity of the profession are relevant, as is the general principle of beneficence and non-maleficence. The social worker must engage in a process that allows the client to participate in decision-making to the greatest extent possible, even if that decision is not what the social worker might deem ideal, provided the client has the capacity to make it. An incorrect approach would be to unilaterally decide for the client based on the social worker's perception of what is best, without a formal capacity assessment, or involving the client in the decision-making process. This violates the principle of self-determination and could be seen as paternalistic, undermining the client's autonomy. Another incorrect approach would be to immediately involve family or legal guardians without first attempting to assess the client's capacity and exploring their preferences. This bypasses the client's rights and may not be necessary if the client retains some level of decision-making capacity. Finally, assuming the client lacks capacity solely due to a diagnosis of a neurological disorder is a form of discrimination and fails to recognize the variability in cognitive function and the potential for individuals to retain decision-making abilities for specific matters. Professionals should employ a decision-making framework that prioritizes client self-determination while ensuring safety. This involves 1. Assessing the client's current capacity for the specific decision at hand. 2. Providing information in an understandable manner. 3. Exploring the client's preferences and values. 4. Involving the client in developing a plan that respects their autonomy as much as possible. And 5. Consulting with supervisors or legal counsel when capacity is questionable or complex ethical dilemmas arise. Question 13. Benchmark analysis indicates a client presence with significant distress, reporting difficulty with consistent access to nutritious food and a safe place to sleep, while also expressing a desire to pursue advanced vocational training. Based on Maslow's hierarchy of needs and a risk assessment framework, which of the following is the most appropriate initial course of action for the social worker? Option A. Focus on building rapport and exploring the client's feelings about their current situation, deferring concrete action on basic needs until the client is more emotionally ready. Option B. Immediately assist the client in enrolling in the vocational training program, as this aligns with their expressed desire for self-improvement and higher-level needs. Option C. Prioritize a comprehensive assessment of the client's food security and housing stability, developing immediate interventions to address these basic needs before exploring vocational training. Option D. Recommend the client seek services from a vocational counselor and a housing assistance agency independently, without direct social work intervention on the immediate needs. Correct answer is C. Prioritize a comprehensive assessment of the client's food security and housing stability, developing immediate interventions to address these basic needs before exploring vocational training. Explanation: this scenario is professionally challenging because the social worker must balance the client's immediate safety concerns with their autonomy and the potential for long-term well-being, all while adhering to ethical principles and regulatory guidelines. The client's presentation suggests a potential regression in meeting basic needs, which directly impacts their overall functioning and ability to engage in higher-level self-actualization. Careful judgment is required to assess the severity of the unmet needs and determine the most appropriate intervention that respects the client's dignity and promotes their progress. The correct approach involves a comprehensive risk assessment that prioritizes the client's physiological and safety needs, as outlined by Maslow's hierarchy of needs. This aligns with the ASWB ethical standards, which emphasize the importance of protecting clients from harm and ensuring their basic well-being. By focusing on immediate threats to physical health and safety, the social worker can establish a foundation upon which other needs can be addressed. This systematic approach is also consistent with generalist practice principles, which advocate for meeting clients where they are and addressing their most pressing concerns first. An incorrect approach would be to immediately focus on higher-level needs, such as self-esteem or self-actualization, without first addressing the client's fundamental physiological and safety deficits. This would be ethically problematic, as it could neglect critical issues that are preventing the client from even considering their personal growth. It also fails to adhere to the principle of risk assessment, potentially leaving the client vulnerable to further harm. Another incorrect approach would be to make assumptions about the client's needs without engaging in a thorough assessment process. This violates the ethical imperative to gather sufficient information to make informed decisions and could lead to interventions that are not relevant or helpful to the client's situation. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's presenting problem, considering their current circumstances and potential risks. This assessment should be guided by relevant theoretical frameworks, such as Maslow's hierarchy of needs, to understand the interconnectedness of different levels of needs. Ethical principles, including beneficence, non-maleficence, and respect for autonomy, should inform the intervention plan. Regulatory guidelines, such as those pertaining to client safety and reporting requirements, must also be strictly followed. The process should be collaborative, involving the client in goal setting and intervention planning whenever possible, while ensuring that the most critical needs are addressed first to promote overall well-being and progress. Question 14. Regulatory review indicates that a client who has a history of insecure attachment in childhood expresses feelings of loneliness and asks the social worker if they would be willing to meet for coffee outside of their scheduled sessions to just talk like friends. The social worker recognizes this request is influenced by the client's early attachment experiences and their current therapeutic needs. What is the most ethical and professionally appropriate response? Option A. Agree to meet the client for coffee outside of sessions, explaining that building a strong rapport is important and that this informal meeting can help strengthen their bond. Option B. Gently acknowledge the client's feelings of loneliness and desire for connection, validate their experience, and explore these feelings within the context of the therapeutic relationship, explaining that maintaining professional boundaries is essential for their therapeutic progress. Option C. Inform the client that their request is inappropriate and that the social worker cannot engage in personal relationships without further exploration of the client's underlying feelings. Option D. Immediately terminate services, citing the client's inability to maintain appropriate boundaries in the therapeutic relationship. The correct answer is B. Gently acknowledge the client's feelings of loneliness and desire for connection, validate their experience, and explore these feelings within the context of the therapeutic relationship, explaining that maintaining professional boundaries is essential for their therapeutic progress. Explanation: this scenario is professionally challenging because it requires the social worker to balance the client's immediate emotional distress and express desire for connection with the ethical imperative to maintain professional boundaries and avoid dual relationships. The client's early attachment experiences have clearly shaped their current relational patterns and their perception of the social worker as a potential source of unconditional support, blurring the lines between therapeutic alliance and personal friendship. Careful judgment is required to address the client's underlying needs without compromising the integrity of the therapeutic relationship or potentially harming the client. The correct approach involves acknowledging the client's feelings, validating their experience of loneliness and desire for connection, and gently redirecting the conversation back to the therapeutic goals. This approach upholds the ethical principle of beneficence by focusing on the client's well-being within the professional context, and non-maleficence by avoiding the harm that could arise from a boundary violation. It aligns with the ASWB Code of Ethics, which emphasizes maintaining professional boundaries and avoiding exploitation or dual relationships. The social worker should explore the client's feelings about the therapeutic relationship and their unmet needs in a way that strengthens the therapeutic alliance and facilitates insight into their attachment patterns. An incorrect approach would be to agree to the client's request for a personal outing. This would constitute a boundary violation and the formation of a dual relationship, which is ethically prohibited. Such an action could exploit the client's vulnerability, compromise the social worker's objectivity, and potentially lead to harm by reinforcing unhealthy relational patterns. This directly contravenes the ASWB Code of Ethics regarding avoiding dual or multiple relationships and maintaining professional boundaries. Another incorrect approach would be to dismiss the client's feelings or abruptly shut down the conversation. While maintaining boundaries is crucial, a dismissive response could be perceived as rejection, potentially re-traumatizing the client given their history of insecure attachment. This would fail to address the client's underlying emotional needs and could damage the therapeutic alliance, hindering progress. Ethical practice requires empathy and sensitivity, even when enforcing boundaries. A third incorrect approach would be to immediately terminate services without exploring the situation further. While termination is sometimes necessary, doing so without attempting to understand and address the client's expressed needs and the underlying dynamics would be premature and potentially harmful. It would fail to provide the client with the opportunity to work through these relational challenges within the therapeutic setting, which is a core function of social work. The professional decision-making process in such situations involves 1. Identifying the ethical dilemma, the conflict between the client's expressed desire and professional boundaries. 2. Consulting the ASWB Code of Ethics, specifically sections on boundaries, dual relationships, and client welfare. 3. Assessing the client's needs and vulnerabilities, understanding how their attachment history influences their current request. 4. Exploring options, considering interventions that address the client's feelings while maintaining professional integrity. 5. Implementing the chosen approach, communicating clearly and empathetically with the client. 6. Documenting the process and rationale. Question 15. Consider a scenario where a social worker is assigned to a case involving a 7-year-old child exhibiting significant behavioral issues at school, including aggression and withdrawal. School staff report that the child's parents are frequently absent due to work demands, and that the home environment is often chaotic, with limited supervision. The child has also disclosed to a teacher that they sometimes feel scared at home due to loud arguments between their parents. The social worker's initial assessment reveals that while the parents express love for their child, they struggle with effective parenting strategies and managing their own marital conflict, which often escalates. Which of the following approaches best aligns with ethical social work practice in this situation? Option A. Conduct a comprehensive family assessment that includes evaluating the child's safety, exploring the parent's parenting capacity and marital conflict, identifying family strengths and support systems, and collaboratively developing a plan that addresses both immediate safety concerns and underlying family dynamics. Option B. Advise the parents to seek couples counseling and inform them that the case will be closed once they demonstrate improved marital communication, without further assessment of the child's immediate safety or behavioral needs. Option C. Immediately initiate proceedings to remove the child from the home due to the reported fear and chaotic environment, prioritizing the child's immediate safety above all else. Option D. Focus solely on the child's behavioral issues at school, recommending individual therapy for the child without engaging the parents or assessing the home environment further. The correct answer is C. Immediately initiate proceedings to remove the child from the home due to the reported fear and chaotic environment, prioritizing the child's immediate safety above all else. Explanation: this scenario presents a professional challenge due to the complex interplay of family dynamics, child welfare, and the social worker's ethical obligations. The social worker must navigate the immediate safety concerns for the child, while also acknowledging the systemic issues contributing to the family's dysfunction, all within the bounds of ASWB, Advanced Generalist Exam Regulations, and ethical standards. Careful judgment is required to balance immediate intervention with long-term support, and to avoid imposing personal biases. The correct approach involves a comprehensive assessment that considers the child's immediate safety, while also exploring the underlying family dynamics and strengths. This approach aligns with the ASWB Code of Ethics, which emphasizes the importance of client self-determination, confidentiality within legal limits, and the responsibility to protect clients from harm. Specifically, it requires the social worker to engage with all relevant family members, gather information from multiple sources, and develop a plan that addresses both the immediate crisis and the contributing factors to the dysfunction. This includes exploring the parent's capacity to provide care, identifying support systems, and advocating for resources that can promote family stability and well-being. The focus is on empowering the family to make positive changes while ensuring the child's safety. An incorrect approach that focuses solely on removing the child without a thorough assessment of the family's capacity to change or without exploring available support systems would be ethically problematic. This could violate the principle of least restrictive intervention and fail to address the root causes of the dysfunction, potentially leading to further trauma for the child and family. Another incorrect approach that involves making assumptions about the parent's intentions or capabilities based on limited information or stereotypes would be a violation of professional objectivity and could lead to biased decision-making. This disregards the ethical imperative to treat each client's system with respect and dignity. Furthermore, an approach that fails to involve the child in age-appropriate ways in the assessment and planning process would be a failure to uphold the child's right to be heard and to participate in decisions affecting their life. The professional decision-making process for similar situations should involve a systematic approach. 1. Prioritize immediate safety. Assess for any imminent danger to the child. 2. Conduct a comprehensive assessment. Gather information from all relevant parties, including the child, parents, and any other involved individuals or systems. Explore the nature and impact of the family dysfunction. 3. Identify strengths and resources. Look for existing coping mechanisms, support networks, and potential for positive change within the family. 4. Collaborate with the family. Involve the family in developing a service plan that addresses their needs and concerns while ensuring the child's safety. 5. Consult and seek supervision. When faced with complex ethical dilemmas or uncertainty, consult with supervisors or colleagues to ensure best practice. 6. Document thoroughly. Maintain accurate and objective records of all assessments, interventions, and decisions. Question 16. Market research demonstrates that individuals often seek social work services due to difficulties in forming and maintaining healthy relationships. A client presents with a history of unstable romantic partnerships and expresses intense feelings of abandonment when their partner does not respond to texts immediately. The social worker is considering how to best apply attachment theory to this situation. Which of the following approaches best aligns with ethical and effective social work practice within the ASWB Advanced Generalist Exam Framework? Option A. Validate the client's feelings of abandonment while gently exploring how their early relational experiences might be influencing their current reactions to perceived slights from their partner, aiming to foster insight into their attachment patterns. Option B. Minimize the client's feelings of abandonment by explaining that their reactions are disproportionate to the situation and that they need to develop a thicker skin. Option C. Immediately reassure the client that their feelings are valid and that their partner's behavior is unacceptable focusing solely on immediate emotional comfort without exploring underlying patterns. Option D. Inform the client that their reactions are a direct result of an insecure attachment style, suggesting they are likely to repeat these patterns in all future relationships. The correct answer is A. Validate the client's feelings of abandonment while gently exploring how their early relational experiences might be influencing their current reactions to perceived slights from their partner, aiming to foster insight into their attachment patterns. Explanation. This scenario presents a professional challenge because the social worker must balance the client's immediate emotional needs with the long-term implications of their attachment patterns, all while adhering to ethical practice standards and the ASWB Advanced Generalist exam's regulatory framework. The client's expressed desire for immediate validation, while understandable, could lead to interventions that inadvertently reinforce unhealthy relational dynamics if not carefully considered within the context of attachment theory. Professional judgment requires understanding how early attachment experiences shape adult relationships and the potential impact of interventions on these patterns. The correct approach involves a nuanced application of attachment theory, recognizing that while immediate emotional support is crucial, the social worker must also guide the client toward understanding the roots of their relational difficulties. This approach aligns with the ASWB Code of Ethics, which emphasizes promoting the well-being of clients and helping them achieve self-determination. Specifically, the code mandates that social workers should engage clients in a manner that respects their dignity and worth, and that interventions should be client-centered and evidence-based. Applying attachment theory in this manner allows the social worker to provide empathetic support while also facilitating insight and promoting healthier relational patterns, which is a core tenet of advanced generalist practice. An incorrect approach would be to solely focus on immediate emotional validation without exploring the underlying attachment patterns. This fails to address the root cause of the client's relational struggles and could lead to a cycle of seeking external validation without developing internal coping mechanisms. Ethically, this approach might be seen as providing superficial support that does not promote lasting change or self-sufficiency, potentially violating the principle of competence and the obligation to help clients achieve their goals. Another incorrect approach would be to immediately label the client's behavior as indicative of a specific attachment disorder, without thorough assessment and exploration. This premature diagnostic labeling can be stigmatizing and may not accurately reflect the complexity of the client's experiences. It also bypasses the crucial process of collaborative exploration and client empowerment, which is central to ethical social work practice. The ASWB Code of Ethics stresses the importance of accurate assessment and avoiding undue influence or labeling. A further incorrect approach would be to dismiss the client's feelings as simply a manifestation of their attachment style, without acknowledging the validity of their current emotional distress. While attachment theory provides a framework for understanding, it should not be used to invalidate present feelings. This approach would be ethically problematic, as it fails to demonstrate empathy and respect for the client's lived experience, potentially damaging the therapeutic alliance and hindering progress. A professional decision-making process for similar situations should involve a thorough assessment of the client's presenting problem, considering their history and relational patterns through the lens of attachment theory. The social worker should then collaboratively develop an intervention plan that integrates immediate emotional support with strategies aimed at fostering insight into attachment styles and promoting the development of secure relational behaviors. This process requires ongoing ethical reflection, adherence to professional standards, and a commitment to client empowerment and self-determination. Question 17. The investigation demonstrates that a client has recently received a diagnosis of a genetic disorder with potential implications for other family members. The client expresses significant anxiety about how this information might affect her relationships and is hesitant to share it with her adult siblings. The social worker's primary responsibility is to support the client in making informed decisions about her genetic information. Which of the following approaches best aligns with professional, ethical, and legal standards? Option A. Respect the client's decision regarding disclosure, providing her with resources and support to manage her anxiety and explore her options for communication. Option B. Advise the client that she has a moral obligation to inform her siblings, regardless of her personal feelings. Option C. Inform the siblings directly about the genetic disorder, citing the potential for familial risk. Option D. Encourage the client to disclose the information to her siblings, emphasizing the potential health benefits for them. Correct answer is D. Encourage the client to disclose the information to her siblings, emphasizing the potential health benefits for them. Explanation. This scenario is professionally challenging because it involves a complex interplay of genetic information, family dynamics, and the social worker's ethical obligations to both the client and potentially other family members. The social worker must navigate the client's right to privacy and self-determination, while also considering the potential impact of the genetic disorder on other family members, particularly if there is a risk of heritable transmission. The ASWB Advanced Generalist exam emphasizes the application of ethical principles and legal mandates within the U.S. regulatory framework, which prioritizes client confidentiality and informed consent. The correct approach involves a thorough assessment of the client's understanding of the genetic disorder, its implications, and her wishes regarding disclosure. This approach aligns with the ASWB Code of Ethics, specifically Standard 1.02, Self-Determination, which mandates respecting clients' right to self-determination, and Standard 1.07, Confidentiality, which requires social workers to protect client information. It also aligns with the principle of informed consent, ensuring the client is fully aware of the potential consequences of any decision to share information. The social worker's role is to empower the client to make informed choices, providing support and resources without coercion. An incorrect approach would be to unilaterally disclose the genetic information to other family members without the client's explicit consent. This violates the client's right to privacy and confidentiality, as mandated by Standard 1.07 of the ASWB Code of Ethics. Such a breach could erode trust, damage the therapeutic relationship, and potentially lead to legal repercussions. Another incorrect approach would be to pressure the client to disclose the information, undermining her self-determination. Standard 1.02. This paternalistic stance disregards the client's autonomy and her right to control her personal information. Finally, failing to explore the client's feelings and concerns about disclosure, or to offer support in navigating these complex issues, represents a failure to provide adequate psychosocial support, a core social work function. The professional decision-making process for similar situations should begin with a comprehensive assessment of the client's situation, including their understanding of the issue, their values, and their goals. The social worker must then identify relevant ethical principles and legal mandates, such as confidentiality, self-determination, and informed consent. The next step involves exploring various options and their potential consequences, always prioritizing the client's well-being and autonomy. Finally, the social worker should document their decision-making process and the rationale for their chosen course of action. Question 18. The analysis reveals that a client who exhibits characteristics of an avoidant attachment style expresses a strong desire to live independently in their own apartment, despite a history of unstable housing and limited social support. The social worker has concerns about the client's ability to manage daily living tasks and potential safety risks in this new environment. Which of the following approaches best aligns with ethical and professional practice in this situation? Option A. Focus solely on the client's expressed desire for independence, providing minimal support and allowing them to navigate the challenges of independent living without further intervention. Option B. Respect the client's expressed desire for independence and immediately assist them in securing an apartment, deferring further assessment of risks until after they have moved. Option C. Collaboratively develop a comprehensive safety and support plan with the client, incorporating their preferences for independence while addressing identified risks and ensuring access to necessary resources. Option D. Override the client's decision and insist they accept placement in a supervised living facility, citing concerns about their attachment style and past instability. The correct answer is C. Collaboratively develop a comprehensive safety and support plan with the client, incorporating their preferences for independence while addressing identified risks and ensuring access to necessary resources. Explanation. This scenario presents a professional challenge because the social worker must balance the client's stated desire for independence with the potential risks associated with their attachment style and current living situation. The client's avoidant attachment style may lead them to dismiss or minimize concerns about their safety and well-being, making it difficult for the social worker to assess the situation objectively and intervene appropriately. Careful judgment is required to ensure the client's autonomy is respected, while also fulfilling the social worker's ethical obligation to protect vulnerable individuals. The correct approach involves a nuanced assessment that acknowledges the client's attachment style without allowing it to dictate the entire intervention. This approach prioritizes building rapport and trust, using empathy to understand the client's perspective, and collaboratively exploring potential risks and supports. It aligns with ethical principles of self-determination and beneficence, as outlined in the ASWB Code of Ethics, which emphasizes respecting clients' right to make their own choices while also ensuring their safety and well-being. The social worker should work with the client to develop a safety plan that addresses their concerns and incorporates their preferences, empowering them to make informed decisions about their living situation. An incorrect approach would be to dismiss the client's concerns or to overrule their decisions based solely on the social worker's interpretation of their attachment style. This would violate the principle of self-determination and could damage the therapeutic alliance. Another incorrect approach would be to solely focus on the client's expressed desire for independence without adequately assessing for potential risks, which could lead to a failure to protect the client from harm, violating the duty of beneficence. A third incorrect approach would be to impose a solution without client involvement, which undermines the client's autonomy and is unlikely to be sustainable. Professionals should approach such situations by first conducting a comprehensive risk assessment, considering the client's attachment style as one factor among many. They should then engage in collaborative problem-solving with the client, validating their feelings and concerns, while gently exploring potential challenges and solutions. Building a strong, trusting relationship is paramount, allowing for open communication and shared decision-making. The ASWB Code of Ethics guides this process by emphasizing client-centered practice, informed consent, and the social worker's responsibility to protect clients from harm. Question 19. The performance metrics show a consistent pattern of clients in a specific urban neighborhood experiencing difficulties accessing essential services, leading to increased stress and reduced overall well-being. As an advanced generalist social worker, which of the following approaches best reflects a person and environment perspective in addressing this issue? Option A. Advocate for increased funding for mental health services in the neighborhood without directly assessing the specific service access challenges clients are currently facing. Option B. Provide clients with a comprehensive list of all available services in the wider metropolitan area, regardless of their proximity or accessibility to the neighborhood. Option C. Conduct a thorough environmental scan of the neighborhood to identify specific barriers to service access, such as transportation, affordability, and cultural competency of service providers, and then collaboratively develop a plan with clients to address these identified barriers. Option D. Develop and implement a series of workshops for clients focusing on enhancing individual coping mechanisms and resilience to manage stress effectively. Correct answer is D. Develop and implement a series of workshops for clients focusing on enhancing individual coping mechanisms and resilience to manage stress effectively. Explanation. This scenario presents a professional challenge because it requires the social worker to balance the immediate needs of a client with the broader systemic factors influencing their well-being, all while adhering to the ethical principles and regulatory frameworks governing advanced generalist practice in the United States, as defined by the ASWB. The performance metrics, while indicating a need for intervention, do not fully capture the complex interplay of individual, familial, community, and societal influences that contribute to the client's situation. A person and environment (PI) perspective is crucial here, demanding that the social worker look beyond individual pathology or deficits to understand how the client's environment shapes their experiences and behaviors. The correct approach involves a comprehensive assessment that integrates the client's self-report with observations of their interactions within their environment, and an exploration of available community resources and systemic barriers. This aligns with the ASWB Code of Ethics, which mandates that social workers strive to strengthen clients' capacity to resolve problems and enhance well-being by addressing environmental factors. Specifically, Standard 105A of the ASWB Code of Ethics emphasizes the importance of understanding clients within their social context. Furthermore, the ASWB exam framework emphasizes the application of PIE to understand the reciprocal relationship between individuals and their environments, guiding interventions that address both individual needs and systemic issues. This approach respects client self-determination by empowering them with information and resources to navigate their environment. An incorrect approach would be to focus solely on individual coping skills without addressing the environmental stressors. This fails to acknowledge the PIE perspective by overemphasizing individual agency while neglecting the impact of systemic issues like lack of affordable housing, inadequate public transportation, or discriminatory practices, which are often beyond the individual's direct control. Such an approach could lead to client frustration and a sense of failure, violating the ethical principle of promoting client well-being and dignity. Another incorrect approach would be to solely advocate for systemic change without engaging the client in developing immediate coping strategies or accessing available resources. While systemic advocacy is a vital component of social work, neglecting the client's immediate needs and their capacity to utilize existing supports would be a disservice. This overlooks the immediate impact of the environment on the client's current functioning and their right to receive support that addresses their present challenges. A third incorrect approach would be to make assumptions about the client's environment based on stereotypes or limited information, without direct engagement and assessment. This violates the ethical mandate to treat clients with respect and dignity, and to avoid discrimination. It also undermines the PIE perspective by imposing external interpretations rather than collaboratively understanding the client's lived experience within their unique environment. The professional decision-making process for similar situations should involve a systematic application of the PIE framework. This begins with a thorough client-centered assessment that explores the client's strengths, challenges, and the environmental factors, social, economic, political, cultural, influencing their situation. It then involves identifying potential interventions that address both individual needs and environmental barriers, prioritizing those that empower the client and promote self-determination. Collaboration with the client throughout the process is paramount, ensuring that interventions are relevant, respectful, and effective. Question 20. To address the challenge of a client expressing significant frustration with the slow pace of therapeutic progress and demanding immediate, more forceful interventions to change their problematic behaviors, which of the following approaches best aligns with the ASWB Advanced Generalist exam's regulatory framework and ethical guidelines? Option A. Agree to the client's demand for a completely new, untested intervention strategy that promises rapid results, even if it lacks empirical support, to alleviate the client's immediate distress. Option B. Collaboratively reevaluate the client's goals and the current intervention plan, explaining the principles of gradual behavioral change and exploring the integration of observational learning and self-efficacy strategies to build new coping mechanisms. Option C. Terminate services due to the client's perceived impatience and resistance to the established therapeutic process, suggesting they seek a therapist who can offer quicker solutions. Option D. Immediately implement more intense, punitive measures for each instance of the problematic behavior to demonstrate a commitment to rapid change and satisfy the client's demand for decisive action. The correct answer is B. Collaboratively reevaluate the client's goals and the current intervention plan, explaining the principles of gradual behavioral change and exploring the integration of observational learning and self-efficacy strategies to build new coping mechanisms. Explanation. This scenario presents a professional challenge because the social worker must balance the client's immediate distress and desire for rapid change with the ethical imperative to employ evidence-based interventions that promote sustainable behavioral modification. The client's frustration with slow progress, while understandable, risks leading to premature termination of therapy or a demand for less effective, potentially harmful approaches. The social worker's judgment must be informed by the ASWB Advanced Generalist exam's regulatory framework, which emphasizes client well-being, informed consent, and the use of interventions supported by research and ethical guidelines. The correct approach involves a thorough assessment of the client's current behavioral patterns and the underlying principles of learning theory that may be maintaining these behaviors. This includes identifying antecedents and consequences, as well as exploring the client's cognitive interpretations, which are central to Bandura's social learning theory. By collaboratively developing a plan that incorporates gradual exposure, reinforcement of desired behaviors, and skill building, the social worker respects the client's autonomy while adhering to ethical standards of competence and efficacy. This aligns with the ASWB Code of Ethics, which mandates that social workers practice within their areas of competence and use interventions that are in the best interest of the client. An incorrect approach would be to immediately implement drastic measures or solely focus on punishment for undesired behaviors. This fails to acknowledge the complexity of behavior change and can be counterproductive, potentially increasing client resistance and damaging the therapeutic alliance. Such an approach would violate the ethical principle of avoiding harm and could be seen as a failure to provide competent services, as it disregards established principles of behavioral modification that emphasize positive reinforcement and gradual shaping. Another incorrect approach would be to solely rely on the client's immediate demands for change without a systematic assessment or intervention plan. This could lead to superficial changes that are not sustainable and may not address the root causes of the client's difficulties. Ethically, this would represent a failure to provide professional services that are grounded in evidence and best practice, potentially leading to a lack of progress and client dissatisfaction, which could be construed as a breach of professional responsibility. The professional decision-making process in such situations requires a systematic approach. First, conduct a comprehensive assessment to understand the client's presenting problem from a behavioral perspective. Second, collaboratively set realistic and achievable goals with the client. Third, select interventions based on established behavioral theories, e.g., operant conditioning, classical conditioning, social cognitive theory, that are appropriate for the client's situation and align with ethical guidelines. Fourth, continuously monitor progress and adjust the intervention plan as needed, ensuring client involvement throughout the process. And fifth, maintain open communication with the client about the rationale for interventions and expected timelines.